All right, guys, welcome to our fourth workshop. This workshop is going to be on current issues and conflicts in the PT just industry, occupation in general. So we're going to go and dive right into it. I'm going to go and share my screen of a slide that I prepared. And then okay. All right, cool. So can you guys see the presentation? All right, okay. So like I said, it's on current issues and conflicts in physical therapy right now. And when I say right now, this is like stuff that I found over like the last recent years, like 4 or 5 years at most. And then obviously a lot of this stuff is still super relevant. A lot of like mandates and laws are changing regarding a lot of this stuff. So I didn't try to include too much details. It's just what the issues are, and just kind of like a broad overview of a lot of them, just so that you guys can be aware. And this is something that you guys can use in the future. And I'll go more into that right now. Okay, so first of all, why do we care? So I'm thinking like in our future tense, like what does PT even look like for us in the future? Like if you guys have thought about that, awesome. If you haven't, you should start thinking about it. I think this coincides a lot with what our speaker was talking about yesterday in yesterday's general meeting. He talked about a lot of issues right now, and a lot of us, I don't know, like if we weren't ready for that or like whatever. I didn't expect him to go into a lot of the stuff that he went into, but it was super raw, it was super real, it was awesome. So shout out to him. What is his name? David Gutierrez, or I think it was something like that. Gonzalez, I don't know. Anyways, he was awesome, but we're gonna go into a few of the things that he talked about, and then we're gonna kind of capitalize on some of that too, and just get you guys thinking about why it's important to even know about all these issues and stuff that are going on in our career. So first of all, what does it look like, and what do we want it to look like? I know I want a lot of the stuff to change after doing the research on it, and I'm sure some of you guys will too. I think a lot of it is definitely um, like able to change, if that makes sense. I think we as a future can definitely have an impact in that, and I think a lot of PTs have impacts in that right now. We see PTs like Dr. Justin Lee and stuff like that. Those are like big name PTs. He's a big name PT in regards of like helping DPT students and stuff like that. There are other DPTs that are just big name in that particular field and that do research and that are just pristine, well-known professors of physical therapy and whatever the case is. So if we're going to be one of those big names, which I think we should all strive to be, I think we definitely have it in our hands to influence some of this stuff. But anyways, we care for those reasons, for like future reasons. Also, we have a lot of current commitments, like David was talking about yesterday. We devote our time, our money, and just like a lot of emotion into our future careers, into being a student of physical therapy or a pre-student of physical therapy. And well, like with that being said, we need to care about it, right? So like, why are we going to do something that we don't care about? And that goes into what he was talking about yesterday is do we really want this? And I know I still do after the presentation. You guys are all here right now in this workshop, so it seems like you guys still do. If you're on the edge about it, that's completely fine. I feel like we're all just kind of figuring everything out. We still don't know a lot about the field. I didn't know a lot about this stuff that is gonna be presented either. So, but I mean, not all of it's bad. And I'll go over that in the last slide too. But anyways, there is a necessity for change, and that's another reason we need to care, is because things need to change. The world is constantly changing, not just in PT, but we need to change in healthcare as well. This is occurring everywhere. All these issues, so it's not just isolated to physical therapy, but that doesn't change the fact that we need to care about it any more, any less than any other aspects or divisions of healthcare or life in general. And then one of the most important things for us right now, reasons why we should care, is DPT admissions. So again, I've talked about this before. Interviews and admission boards, they want to see you invested in physical therapy as a whole. Hence, us needing and requiring X amount of hours in X amount of fields of physical therapy, and us requiring um, X amount of volunteer hours and this and that. They want to know that we're invested in physical therapy and invested in our futures, because they're not going to take on students who, yeah, maybe can still get through their schooling and get the degree and stuff like that, but who are just going to leave the field or like abandon or like not care as much about this field as they would like. They want to produce students who are going to show out for them and represent that DBT program well in the future, and who are going to change a lot of these issues in the future to have a good influence. Um, all right, so the topic list that we're going to be going over is going to be right here. This isn't limited to all the topics that I could find. I just wanted to include not necessarily the most important, but some that really stood out to me, some that are pretty important, and just some that are easy to digest and easy to remember, most importantly, for when you do get to that interview or get to that situation where you need to talk about um issues and conflicts going regarding physical therapy and what the current standards are and stuff like that. So these are just all stuff that should stick with you guys. There's stuff that's like easy to understand. It's super conceptual. And you maybe not have thought about it, but it's easy to think about, if that makes sense. So we'll dive into a lot of those, but those are going to be insurance. Insurance, I didn't have its own separate slide, but because it's so applicable to pretty much all of these topics. There's insurance issues in income, insurance issues in advocacy, in policy, and in GPT school. I mean, there are too, always like FAFSA and stuff like that. That's not really insurance, but there's insurance issues in all of these, so it's kind of just mixed up in there. But moving on, we're gonna start with policy. And again, I didn't include everything that is regarding to policy and insurance and school and all that and all of these. I picked some of them that I thought stood out, and we're going with it right now. And again, I'm not trying to be super detailed because I don't want to be outdated. Number one. Number two, I don't want to mislead you guys on any information. Number three, I think there's so much information that it's like surface level stuff anyways that I kind of like read over, and there's so much more to read about it. So again, going back to me not wanting to mislead you guys, it is something that you guys do need to go back and like look into if you really want to get really good grasps on everything and be able to talk about it with an adult or like professional adult or whatever. So let's get into it. Policy. There's four that really stood out to me: telehealth, physical therapy, compact, scope of practice, and then insurance, the insurance aspect to this one. So starting with telehealth. Telehealth really started, or like not started, but it got big in during COVID-19. It got big on all scales. So not just talking about physical therapy, we're talking about medical doctoring, just clinical settings, just whatever the case is, just like over the counter telehealth, like simple stuff to complex stuff, right? Um, there's a lot of social distancing mandates, and it was an epidemic, so a lot of these policies changed, and telehealth got really big. But I think one of it is still an issue today because telehealth got big, they're still incorporating it, and it's still something that needs to be incorporated in case an epidemic or whatever the case is happens again in our near future or late future, whatever the case is. It's something that needs to grow and needs to develop, as we already learned. Um, we had met this guy, Mark. Okay, and then but yeah. So first of all, one of the main problems with that is a lot of PTs and professionals in general, they're still adapting to telehealth. Like they don't have a complete grasp on how to treat people virtually and stuff like that. So that is a really big obstacle still. I think there needs to be more guidance on that. And I think they are still working on protocols for telehealth as well, which is good. Another one is quality of care. The reason I mentioned quality of care is because in physical therapy specifically, we all know that the bond and the connection and modality of care that physical therapy has to offer versus other fields is what distinguishes it, right? So quality of care is definitely diminished, I think, through telehealth, physical therapy especially, because you think about modalities and you think about manual therapy, you think about all these different machines that you can put your patients on and all these different interventions that you can expose them to like speed up the healing process and to get them to their goals and stuff like that. Obviously, we all know PTs give you guys homework or give their patients homework and stuff like that. That's awesome. But that homework is usually surface level stuff. It's usually body weight stuff, simple stuff, minimal equipment stuff. So with that being said, quality of care I think is like 100% diminished in telehealth for physical therapy, and I think that's a big issue. So there, I hope there's some way to mitigate that, um, or maybe there's not, but there has to be some kind of protocol that is going to be set in place and stuff to enhance telehealth and physical therapy, or maybe doing like hybrid options as well. I did read into that a little bit, where it's not complete exposure like a physical therapy usually goes through, where they see their patients twice, 3 times a week, for extended periods of time, but maybe it's once a week or once a month, and they still give them the tools, but even more tools to proceed with their rehab, right? And then also a safety hazard concerning telehealth with policy and issues in physical therapy is that physical therapists aren't there at the person's house if it's through telehealth to make sure they don't fall, to make sure they're doing exercise correctly, to make sure they're recovering at the rate and at the safety that they need to be recovering at. So that's another big issue I think, or that I see in telehealth physical therapy. Um, the next thing I'm going to mention is physical therapy compact. This allows PTs and PTAs. This is also inclusive to occupational therapists and stuff like that too, to practice in their states. So this compact, it's present in a lot of states, but not all states. There are a lot of states that they just require so much more for you to practice in their states than other states do. So if you have the license to practice in Texas, it's going to be completely different to practice in California, for example, and stuff like that. I think there's definitely differences from state to state. Like there's no denying that, but there's definitely conflicts in like the limitations of that, right? To go and practice wherever you want. And obviously you could look into travel physical therapists. I'm sure there's like leeway around that too, but I think that needs to be more efficient. And then there's a lot of variability in protocol between states, and I think that should change as well to make those limitations or to decrease those limitations. But anyways, next we have our scope of practice, and this is going to be imaging limitations, dry needling limitations, and also different responsibilities that PTs are kind of growing into. So when I say imaging and dry needling limitations, PTs in most states are not permitted to request imaging and like screenings such as MRIs and stuff like that. They need like an MD or ortho or whatever to request those screenings for their patient, which goes along with the responsibilities that I'm gonna bring up right now too. They are asking of PTs for more responsibility, and these responsibilities include like red flag responsibilities. These include like looking at history more. If you guys didn't know, PTs have like the longest evaluation time frames out of like pretty much any doctors. I think if you ever go to a regular doctor, they will see you for a few minutes, check out your ankle, your knee, or whatever the case is, even if it's something else, and they're like, oh, okay, like boom, that's it. Check back in with me for a month. Like it's really not super extensive. You go to a physical therapist, you're in that eval room for about an hour, and they're doing all these tests. They're asking so many more questions. They're doing all these things for a diagnosis. Even if they already have a diagnosis, they're still asking so much questions because they're going to be working with you so much more than a regular MD will. And so that just goes along with red flag responsibilities. They're looking for red flags in family or like patient history, red flags in like daily life, daily activities, just red flags in general. And pathologies, like essential pathology is super serious, like your central nervous system and stuff like that. So if an MD misses that and you're the PT and you have all this schooling, that doesn't mean that you can't catch this central pathology that maybe an MD missed. Like we're just as educated and informed as a lot of these MDs. So it's kind of at least like book wise, right? Textbook wise. They go through their residencies and stuff like that, so which is a little bit longer, but regardless, PTs are being tasked with a lot more responsibility, which I think is a good thing, but it can also be an issue when we talk about income and stuff like that. But we'll talk about that a little bit later. Um, the last one is gonna be insurance. Obviously, we know there's so many like issues with insurance, but there are declining insurance reimbursements. All that means is the money that insurance pays back to a company or to a clinic or whatever providing the service, that's just declining. So that needs to be more efficient. Um, there's very different reimbursement protocols from hospitals to outpatient settings and stuff like that. So that needs to work on that. And then Medicaid advocacy. So Medicaid is just I I think you guys have heard, if you guys ever worked at an outpatient clinic, a lot of patients and stuff like that, you can probably hear them complaining about Medicaid or some kind of um, insurance that they have. So there's so much more to dive into that. I don't want to go crazy. All right, next we're gonna talk about income. Um, David talked about this yesterday, uh, so we'll get a little bit more into it, but I'm just gonna skim through it kind of fast. So low satisfaction and competitive pay. He already talked about this. One of the top 5 concerns for the future success of PTs is income. So it's literally just competitive pay, and you'll notice that some incomes are higher than others depending on location, and that's going to be the main factor as far as income goes is going to be location. We do have declining reimbursements, like just regular job reimbursements. So not regarding insurance, just regular reimbursements. And all that means is reimbursement is something that you give back, right? Like something that's borrowed and is given back, or you're giving something back to somebody if you're reimbursing them. Um, so if there's declining reimbursements, the money that you're getting back from the work that you put in is what I mean by declining reimbursements, or like what the internet means by declining reimbursements. So basically the work to income ratio is just, I guess, like kind of poor. And I have that right there, labor to income ratio. And I think that becomes in and of itself a care quality issue, where obviously if a PT um, is putting in all this work and not getting as much money, I'm not going to say they're going to lose passion about it. But another one that I didn't include directly on here, but is still like a super relevant issue, is occupation burnout. And that's a huge issue in physical therapy. And part of that is because of the income labor ratio. But anyways, we'll move on to um, leadership salaries are declining and physical therapy salaries are increasing. So I thought this was super interesting because when you think about being a physical therapist, you think about, oh, I'm going to own my own clinic, or maybe you're not, but if like some people do, like, oh, I'm going to own my own clinic, I'm going to make bread, like blah, 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 this and that. That can be true and it has been true. But at the same time, um, you'll see if you look it up that directors, they understand that pay is declining in a lot of cases, and a lot of them are paying their employees before they pay themselves. That doesn't mean that they're getting paid less than their employees, definitely not, but for their job description and for their requirements, owning and managing a clinic, they should be getting paid, in my opinion, like way more than a regular physical therapist that's just practicing in their clinic. And they can't do that if they're not getting the correct and sufficient funds and stuff, and the right laws aren't being passed to be able to pay their employees. Um, and with that being said, turnover is at a like all-time low, I think, right now, or at least in 2021 it was. And that's just it's just ridiculous on how that works. You should be able to do your job, especially as a doctorate or like with a doctorate degree, and with increasing responsibility, you should be getting increasing pay. And that's not always the case, at least right now. Um, our next one is in school. So this is mainly with like student debt. But 1 in 2 students graduate with over $70,000 in debt. and this is increasingly progressive. So, or it's increasing progressively, meaning that this number is increasing like as we go on the years. Tuition for DBT programs is getting higher, and students are having to take out more loans and therefore have more debt. Um, and with that being said, the student debt income ratio is not very good too. That's super low. So coming out of school, that's a huge issue for a lot of students. And I think a lot of students are like kind of stressed out about that, especially us right now when we're choosing our schools pretty soon that we're going to be going into. We're like, oh man, what's the cheapest option? Or maybe you're not, but even like a lot of us are, and we're like, man, like we might not think about it as much about like student debt, but it's definitely there after we graduate, and we can't just it's not just something that we can ignore. Um, and then next we have continuing education credits. So as you guys know, there's constant research and constant advancements in any fields, especially healthcare and especially physical therapy. With that being said, there is continual education even after you already get your doctorate in physical therapy school. So that comes with costs as well. And that's something that is just going to be going on, and it's going to be ongoing as you go throughout your career. Next, I put some strategies in here that I saw on a website that I was researching a lot of this stuff on, and they gave some insight on what you can do to kind of like assist in like the student debt issue and stuff like that. So, and like raising income, so like there's an income issue as well. So it's like job hopping. It was talking about how job hopping allows you to request competitive pay from your applying job to your previous job. So if you job hop every like couple years, you can increase your pay grade more than you would be if you're sticking at one location for a longer period of time, where longevity really doesn't increase pay grade as much. You know, if you're getting paid at that clinic 75,000 a year, you're probably not going to be getting too many bonuses in physical therapy. And a way to kind of mitigate that and just get more pay in anyways is going to another clinic and saying, hey, I got paid 75K at this clinic. You guys are in need of a physical therapist. What are you guys going to pay me? Like 5% more, whatever the case is. Like you can kind of negotiate your way in that respect. Travel PTs, they do make a little bit more money, I think, and they also they also save money and reduce tax dollars, and a lot of that is just like housing taxes. So that's another option to look at, especially if you want to travel and stuff like that too. I think that's really cool. And also loan forgiveness. So even if you do have a lot of debt, the government's literally always like, there's always some kind of party, like political party, pushing for pre-education and relieving loans and stuff like that. So that's definitely an option or a possible option. Next, we have advocacy. So there's the administrative burden, direct access, and a fair copay advocacy that I want to talk about right now, because those are like some of the most important ones, I think. So for administrative burden, all that means is that PTs, they're burdened with paperwork, they're burdened with so many extracurricular tasks outside of treating their patients, that I think like that it will affect patient outcome and progress. Maybe not substantially, maybe not super significantly, because their patients are still getting the work in, they're still getting stuff like that, but they're not getting the one-on-one treatment that they need, depending on what kind of setting you're in. Typical outpatient orthopedic settings that we all like are mostly exposed to, those ones, as you guys can see, your PTs have like 4 techs at a time sometimes, and it's like, or four patients at a time sometimes, and it's like, dude, like they talk to their patient at the beginning and at the end, and that's it. Like they might not even touch their patient for any manual or any like special like modality that their patient would be um benefiting from otherwise. So I think that's a pretty big issue, and that's definitely like a proclaimed issue in the community of physical therapy. Next, we have direct access. Um, so direct access is the removal of physician referrals for physical therapy. Um, this is super limited in most states, and there's just a lot of limitations on if a patient can seek physical therapy, which is something that they might need in the moment before they can get their doctor's visit, which might not be for 3 months, 4 months because of their doctor's schedule. So I think that's something that definitely needs to change. There are a lot of states that have direct access laws already set in place, but there are still so many limitations on that. And you guys can look more into that as well. I think that'd be smart just to know more about it. Next is this one's going to be essential advocacy, and it's on fair copays. This is another insurance problem. So insurance provisions impose higher copays for PT sessions. This is a huge problem because, as we all know, uh, when you go to a physical therapist, you see them for like ongoing periods of times. You see them multiple times a week sometimes. So if you have a copay that's just as much as your MD copay, that's like, let's just say it's $150 with your insurance. Some insurances are cheaper, like 25, whatever the case is. But if you're paying even $25 3 times a week for 5 months, 6 months, 7 months, 8 months, whatever, that's a lot of money that is just like super redundant for you to be paying, especially at the frequency that physical therapy is set at. And then when you get up to those copays of $100 or more, like it's honestly just ridiculous because physical therapy is something that's needed for a longer period of time, in most cases, and especially in serious cases. So to be paying that much is definitely something that needs to be fixed as well. And then very few states have fair copay laws set in place. So that's definitely something that can be worked on. Next, this is the last one actually, or like one of the last slides that I have for you guys. I went over pretty much all four that I wanted to talk about. This last one is just to remind you guys, that it's not all bad. I talked about a lot of the negative because this is what this is about, and not because PT is all negative. That's definitely not the case, but because again, this is stuff that you kind of want to know and you need to know because it's going to be your future, right? But these issues are applicable to all healthcare occupations, like I was saying earlier, and there's still so much to talk about and so much to dive into. You guys can't limit yourselves to just these slides. Definitely venture out and look at more of those issues and stuff that occur in the PT industry and like occupation. And this definitely wasn't for discouragement. This workshop nor our general meeting yesterday, that PT, like had super dark humor. He was funny for sure. And he was just really real with us. But don't take his positive words lightly either. He was talking about how much he did love the field. He did talk about how rewarding it was in a lot of aspects, but he was just being real with us on a lot of the negatives. And that's completely fine. I think we need to be aware of them. But this is definitely not for your discouragement. It's for you guys to be informed. It's for you guys to be prepared. And I think a big part of this that I took from it is I'm ambitious to change our field and stuff like that, and to be a really good physical therapist when I do become one and when I do graduate DPT programs or a DPT program. So that's just something to take home with you guys. And then use this for your applications. I've said a million times, use it. They're gonna be impressed that you guys know and that you guys are invested. Do more research, and then finally get involved. There's like so much stuff that you guys can get involved in. One of the main things, we're right next to Austin. One of the main things is when it is time for like lobbying and stuff like that, there are like physical therapy groups and stuff like that that go to Austin and they lobby there for certain mandates and certain rights like direct access and like fair copay acts and stuff like that. So if you can get involved in like a way that's as big as that and you can talk about that in your interviews, that's like crazy. Like I promise you any board of admissions is gonna be impressed with that. And then I think that's pretty much it for you guys. I have some resources right here, which I can share these slides with you guys if you guys are interested in looking more at them and at the issues that we have. So I included some of the resources that I like remembered and like some of the tabs that I saved. And then finally, I have the QR code for you guys. Do y'all have any questions? This is the attendance QR code, by the way. Do y'all have any questions at all for me? I know I kind of like sped through that. I didn't really give you guys too much time. But if you have any questions, definitely let me know. When everybody is done signing or filling out the Google Forms, let me know, and then we'll go and take that picture. If you guys can't reach or can't scan the QR code for any reason, let me know. I can also copy and paste the link in the chat if you need me to.
Can you copy and paste the link in the chat, please?
Yes, I got you.
Thank you.
Hey, Micah, quick question.
Yo,
So I know, don't want my hair. My hair looks crazy, but I know that I don't know if you talked about it because I did a little bit late. But is there actually different pay rates for different specialties? Because sometimes I hear that pediatrics do get paid more than, like, let's say orthopedic or geriatric.
yeah, no, they for sure do. Just like our presenter talked about yesterday, he works at an inpatient on the weekends, and he works as a pediatric outpatient during the week. So they definitely have different pay grades. And one thing I didn't talk about in this presentation is there are different codes and stuff like that for or like ways to bill your insurance and stuff like that. That a lot of like directors, clinic directors, or like just businesses in general will push the PTs to bill for. And that reason is because those modalities and like those methods of treatment are going to be more expensive. And so that goes into how much you get paid as well, a little bit too. And it just really depends on the clinic. It depends on the clinic director. It depends on the owner of the clinics, and state is like a huge factor in like payment and stuff like that. That's probably like that's literally like one of the depending factors is where you live. How much that's how much you're gonna get paid. And then obviously we know that home health, they get paid like some of the most, and that's probably because that's the most demanding field of physical therapy, because I feel like a lot of people don't really want to go into home health. Um, but yeah, it all varies, and not just off of location, but off of specialty, like you said. And there could be a clinic at one hospital that is in like dire need of a pediatric physical therapist because they don't really have any, and they're gonna pay more than a clinic that isn't really in need. So yeah, to answer your question. But anyways, let's take the picture really quick before everyone leaves. Did everybody get the QR code? Or like, did everybody get the link? Yeah. All right, word. Um, we're just gonna go ahead and throw up the Elijah. Are you gonna take? You're on your phone, right? I'll take it on my laptop.
Yeah, if you can take it on your laptop.
All right, but that cool. Okay. All right, everybody, throw up like the birds up thing. Smile. All right, 3, 2, 1. All right, cool. Awesome. Thank you guys so much for coming. Hope you guys learned something. If you guys want the slide, just DM me through GroupMe or whatever, and I'll send it to you guys. But thank you guys. See y'all soon.